Hello all. So today let's talk about iron deficiency anemia. Okay, so a lot of questions come from this topic. So before moving, let's again start about the basics. Okay, so whatever iron I take, okay, is in the form of Fe3 plus. Okay, Fe3 plus ferric form. So this will be transported inside the body and it reaches the duodenum. So this ferric form of iron will not be taken up by the body as such. Okay, it has to be reduced, it has to be converted to ferrous form to be absorbed. Okay, so in the duodenum, this ferric form is absorbed and it is converted to ferrous form. Okay, this ferric form is converted to ferrous form. By whom? It is done by gastric acid or duodenal ferropeptidase or duodenal ferroreductase. Okay, duodenal ferroreductase. So gastric acids or duodenal ferroreductase, these enzymes or these acids, they reduce the ferric to ferrous form. So once it is in the ferrous form, it will be taken up by the small intestine. Okay, it will be taken up by small intestine and it will enter the enterocyte. Enterocyte, what do you mean by enterocyte? Enterocyte is basically a columnar epithelial cells lining the small intestine and it is responsible for the absorption of nutrients. Okay, so it is basically a epithelial cells. So inside the small intestine, it reaches the columnar epithelial cells, which is nothing but the enterocyte, and it is stored here. So this is the very basic things of what happens to iron. So once the iron enters the body, it enters the duodenum. In the duodenum, it gets reduced to ferrous form by gastric acid or ferroreductase, duodenal ferroreductase, and then it is absorbed by the small intestine. Then it enters the enterocyte, which is nothing but the epithelial cells of the small intestine, and it is stored. Now, once this iron in the enterocyte is stored, it has two feet. One is it gets stored. We all know that. Another one is it will be transported in the blood. Okay, when it will be transported? When the body iron stores are less. Okay, so once the body iron stores are less, these iron which are stored in the enterocyte, that is a small intestine, should get transported via the blood. Okay, so the enterocyte as such cannot be transported or as such cannot transport the ferrous form. Okay, so from the enterocyte, the ferrous form of iron, Fe2 plus, moves to the basolateral side of the small intestine, and this process of taking over the ferrous form of iron inside the cell to the basolateral side is done by ferroportin. So ferroportin transports the ferrous form of iron that is present in the enterocyte, that is stored in the enterocyte, to the basolateral side, and then in the basolateral side the ferrous form is again converted to ferric form. The ferrous form is again converted to ferric form. Okay, this is done by EPA estase. So this EPA estase enzyme, it converts the ferrous to ferric again. And now once it is converted, this ferric form of iron is transported to the blood. Okay, inside the blood, this ferric form of iron, it binds to what is called as transferrin. Inside the blood, it binds to transferrin and then it is transported to erythroblast. So inside the erythroblast, you will have what is called as transferrin binding receptor. So with the help of this transferrin binding receptor, which is present in the erythroblast, this ferric form is taken inside the cell. Okay, Fe3 plus enters the erythroblast cell. So inside the cell, it goes and binds to mitochondria, and that is where the synthesis of hemoglobin takes place. Okay, so the hemoglobin, what is the function of hemoglobin? Again, hemoglobin carries oxygen, right? So we'll talk about it. So this is the basic mechanism of iron. Okay, so it is taken up by the duodenum, it is converted into in the small intestine, or it is reduced to ferrous form by gastric acid or ferroreductase, and then it enters and stored in the enterocyte. So once the depletion of the iron in the body gets low, it is transported into the basolateral site by ferroportin, and in the basolateral site it is converted to again to ferric form by epiestase enzyme, and then it is transported to the blood. In the blood it binds to transferrin, and the transferrin carries the iron in the form of ferric to the erythroblast, and with the help of transferrin binding receptor, it transfers this ferric ion into the cell, enters the mitochondria, and produces what is called as hemoglobin. So what is the function of hemoglobin? Hemoglobin, we all know that it has two functions. It carries the oxygen from the lungs to the body tissues. Okay, each molecule of hemoglobin carries 4 oxygen, and it carries the carbon dioxide from the tissues to the lungs. Carbaminohemoglobin. Okay, this is called as carbaminohemoglobin. Okay, now hemoglobin is present inside the RBC. Okay, so whenever there is a deficiency of iron, the hemoglobin is not going to get produced. Whenever the hemoglobin is not going to produce, will the oxygen carry enough oxygen? Will the RBC carry enough oxygen? Obviously. So decreased oxygen carrying capacity of red blood cells is called as anemia. Okay, decreased oxygen carrying capacity by the red blood cells is called as anemia. How? RBC has hemoglobin. Hemoglobin is produced by iron. So this is a chain mechanism. So this is what the pathophysiology of anemia, especially iron deficiency anemia. Okay, now what are the situations the iron in the body might get low? Okay, one is insufficient dietary absorption of iron. Okay, insufficient dietary absorption of iron. Two is increased demand, as in cases of pregnancy or growth. Okay, three is decreased absorption of iron, as in cases of celiac diseases, or there is increased blood loss in case of GI bleed or menorrhagia. Okay, these are all the few causes why the iron depletion takes place. Okay, so it can be because of insufficient dietary absorption of iron, increased demand, decreased absorption, or increased blood loss. Okay, so these are all the situations that triggers the release of the iron from the enterocyte, or in simple words, the deficiency of iron leads to decreased hemoglobin production, which in turn is going to affect the oxygen carrying capacity of an RBC. Very simple terms, right? Okay, now what is the treatment of iron deficiency anemia? Before moving into the treatment, why it is called as microcytic hypochromic anemia? Microcytic hypochromic anemia. Why iron deficiency anemia is called as microcytic hypochromic anemia? Microcytic. What do you mean by microcytic? There is going to be decreased hemoglobin production. Okay, see what happens, because there is decreased hemoglobin, this hemoglobin makes up the majority of the RBCs. It fills the RBCs. So what happens, the RBCs without these hemoglobin will be very small in size, one. And another one is these RBCs will continuously divide to compensate for the hemoglobin. So if the hemoglobin is less, instead of one cell, it will become 5 cells, so that it will accumulate and form the correct amount of hemoglobin needed. So the RBCs, they reduce in size and they multiply more. That is why they look very small and more, increased in number. So small increased number of RBCs is responsible for microcytic. Hypochromic is because the hemoglobin is not present in the RBCs, they look very pale. That is the reason of hypochromic. Okay, so microcytic hypochromic anemia. This is the reason. You should never get confused. Okay, so what is the treatment of this? So I can give, first I should treat the cause. Okay, if there is any underlying cause, I should treat it, and then I can give. So first one is treat the underlying cause, and then I can give oral iron supplements. Ferrous sulfate, ferrous fumarate, ferrous gluconate. Okay, I can give this, and I should check it for every 3 to 6 months, the whether the iron stores or restore. Okay, and then if the oral supplements are not there, then I can give parenteral iron. Okay, so this is how you treat a patient with iron deficiency anemia. Okay, so how these patients are look? Obvious, they look pale, they look weak. Okay, so their body will be under fatigue and they look pale because the hemoglobin production is not good because of the iron store depletion. So this is about iron deficiency anemia. I hope this video makes sense. So thank you so much. Have a nice day.